Good morning. So today we're going to discuss the topic. Few questions have piled up about care before a hair transplant. How should you prepare before a hair transplant? You've already decided that you're coming for a hair transplant out of your town, out of your city. How do you prepare yourself? What are the do's and don'ts before you embark on the journey? What you should know before you arrive at the clinic for a hair transplant. So this is the topic that I'm going to cover, all the questions compiled into one. So if you're traveling from abroad and if you do not have an OCI card, if you're not an expatriate Indian, it's important for you to check with the visa details. It's important for you to get a visa on before arrival. There are a few countries which are exempted from visa. They can get the visa on arrival at the airport. Please check up those countries. But the countries like the United States and UK do not fall in those categories. So please be careful. Visa requirements for India are very different from other countries. So do not get into a problem. I have had, on occasions, 2 patients coming to the airport and having to return back because they did not have a visa. They thought they will get a visa on arrival, as they do in most countries. So that is very crucial. You should know the visa requirements. Visit the External Affairs Ministry website and they will tell you what the visa requirement is. Or if you are our patient, if you are signing up, if you already signed up for us, we will guide you completely how to get a visa. So whether you should travel alone or whether you should bring somebody along with you, well, we are there to look after you. Do not worry. We'll take good care of you. You will have no problem after landing in India. We will pick you up from the airport. The driver will leave you to the hotel which you have already chosen to stay in, and he will also bring you for the pre-operative consultation a day before the procedure. So that is not a problem at all. We are always there to help our patients. There is no problem about coming alone for a hair transplant to India. So the countries which are allowed visa on arrival are, roughly speaking, Australia, Brazil, Cambodia, Cook Islands, Djibouti, Fiji, Finland, Germany, Indonesia, Israel, Japan, Jordan, Kenya, Kiribati, Laos, Luxembourg, Marshall Islands, Mauritius, Mexico, Micronesia, Myanmar, Nauru, New Zealand, Norway, Oman, Palau, Palestine, Papua New Guinea, Philippines, Republic of Korea, Russia, Samoa, Singapore, Solomon Islands, Thailand, Tonga, Tuvalu, UAE, Ukraine, USA, Vanuatu, and Vietnam. These are the countries which are exempt from applying for a visa before embarking on the journey. They can get a visa on arrival. So these are the countries. So be very careful that you are in one of these if you plan to embark on the journey without getting a visa before starting off the journey. So the next questions that people ask are about the do's and don'ts. So before you're planning a hair transplant, make sure that your scalp is in good, healthy condition. There are no pus points. There are no furuncles, boils, sources of infection in the donor area and the plant area and the area which is going to be planted. Do not scratch these areas, because when you scratch these areas in a day or two, there are small points of infection, and we do not want infection to happen after a hair transplant. Keep your head well scrubbed, clean, away from infection. And if you have certain skin conditions like psoriasis, seborrheic dermatitis, furunculosis, please let us know. And please also let us know if you have any diabetes or any other health condition which can cause infection in your scalp, which is detrimental to recovery. And secondly, it will give an outcome which is not what we will expect it to be. So be careful about infection. Do not exercise too heavily on the day of the procedure. Do not have your hair cut short before arriving for the consultation one day prior. Because when you have your hair cut shorter than 1 centimeter, we can really not judge where to place the grafts and where not to place the grafts, how to place the graft strategically, we do not get an idea of the play of light and shadow in your head, which allows us to place grafts more strategically so that you get more bang from your buck. Because what happens is that donor hair that we have are they are not limitless, are limited. So with fewer hair grafts, especially in patients who have extensive baldness, we are trying to create an illusion of fullness of the whole head in extensive baldness with few grafts available. Yeah, if you have a lush donor area, lush body donor, that doesn't matter at all. But most patients who come with extensive baldness have a mismatch between the donor and the area of baldness. So in such cases, you should not cut your hair shorter than an inch before the procedure. If you routinely wear short hair, please make sure that you grow your hair out to at least an inch before you come for the consultation a day before the procedure. Then next is, if you are a heart patient, if you are taking blood thinners, please, in consultation with the doctor, go off these blood thinners around 7 days before, and your INR test, which is a determinant of the thinness of the blood, that is the coagulation of the blood, should be done 1 or 2 days before, so that we know that you will not bleed unnecessarily, because bleeding causes a problem in a hair transplant. It slows down the process. It's not that so much bleeding happens, but brisk bleeding, if it happens actively during the process, will not allow us to place the grafts, because the clotting does not happen fast, and the grafts will fall off as the body oozes blood. So it's very important for you to stop 1 week before blood thinners. And for those people who have a cold or who have routinely certain treatments, certain medications like aspirin and ibuprofen, also please stop these medications because they thin the blood. Please stop these medications 1 week before your hair transplant. As far as alcohol is concerned, you can have, if you're a moderate drinker, if you have about 60 ml, 90 ml of alcohol, no problem, you can have alcohol one night before the procedure. But remember that after the hair transplant, for 4 days that you are on antibiotic, it is always better not to take any alcohol except for, say, a pint of beer at night. That will not harm at all. Smoking is a big no-no for hair transplant, big no-no for healing anywhere in the body. It disrupts healing at the cellular level. Please do not smoke 1 week before and 1 week after the hair transplant. This is absolutely important. About drugs like marijuana, recreational drugs, please do not take them 48 hours before and 48 hours after the procedure. They are detrimental to the preparation for the procedure and to awareness and being conscious of what your duties are as a patient after your hair transplant has been done, taking care of yourself in the right manner that we will be advising you about. And do not take vitamins like vitamin A, vitamin C, and vitamin E. Do not take excessive herbs like ginseng. Do not take excessive herbs like Asian ginseng. And do not take a herb-rich diet 10 days before the procedure, because this causes decreased clotting of blood and it can cause bleeding during the procedure. Then we go on to, do not apply minoxidil. If you are applying minoxidil, which most patients who are suffering from hair loss are applying minoxidil, do not apply 7 days before the procedure. Stop applying minoxidil or any rubefacient, any hair loss medication, or any oil which causes redness of the scalp, because this will cause bleeding and it can cause skin problems, which should not be there. The skin should be completely clean before the procedure. Where to arrive? See, if you're getting a hair transplant done in our Chandigarh clinic, you can arrive in Delhi airport, and from Delhi there are several frequent connecting flights to Chandigarh airport, which is just about 45 minutes away. But if you want a driver to pick you up from Delhi airport, yeah, we can provide that. Our driver will come and pick you up, provided you give us enough notice before you before you're landing in Delhi. We can arrange a pickup. As far as hotel accommodation is concerned, hotel accommodation, we can send you a list of hotels available around the clinic. Make sure that you book a hotel within 5 to 7 kilometers of the clinic so that we can provide a driver. Providing a driver, say 10 kilometers, 25 kilometers away is very difficult because there are other patients also to take care of. So we can provide you a list of hotels. Check online many times on booking.com and on Make My Trip, Ease My Trip, and many other sites, GoIBGo and etc. You can get very good deals online rather than the rack rates that we might provide you. So get the rates that we are giving you and also check online whether those rates are cheaper than what you are being offered online. Many times patients are preferred clients of certain hotel chains like Hilton and all, Radisson. So I think you will get a better deal by booking on your own, but get the details of the hotels that are available nearby the clinic from our office and we'll be happy to provide them. We will give you free pickup and a free drop on 2 days of the one day before the procedure and the day of the procedure. That is not a problem if you are staying within 5 to 7 kilometers of the clinic. Do bring a neck pillow. Neck pillow is required when you travel back to your home country or to your town. Bring a neck pillow which conforms to your neck size so that you're comfortable during the journey back home. About hygiene. Wash your hair 1 day before and on the morning of the procedure with a shampoo which is available in your hotel room. Wash it properly. As it is, we'll be washing again when you come to the clinic. But wash your hair before coming to the clinic so that it is full and we know that where the graft should be placed and where they should not be placed. We have a fair idea of the fall of light and dark on your head. And if you're getting a body hair transplant, say you're getting a beard hair transplant as well, that is, we are harvesting grafts from the beard donor as well. It is very important to shave this area about 48 hours to 36 hours before the hair transplant because we want hair which are only anagen hair to spring up. We do not want poor quality hair to spring up before the procedure so that we can only target those hair which are healthy, which have sprung up in this window period of 36 to 48 hours. I hope you get what you mean. We are aiming at quality grafts which have the maximum potential towards growth, and this can be ensured by wet shaving your beard area 36 to 48 hours before the procedure. So next we go on to the consultation. So when you travel from abroad, when you travel from out of city, just remember that you have to be 2 nights in Chandigarh or in Mumbai if we are doing the procedure in Mumbai clinic. 1 night before the procedure and 1 night after the procedure. So best is to arrive around noon. You can arrive around noon at the airport. Airport is not very far away from our clinic. It's about 20 minutes. And we can have a consultation, a pre-consultation 1 day before. A pre-consultation is a must because it gives you enough time to think over the hairline, to think over the doctor's plan, which might be very different from what you have thought it to be. And if you reach on the day of the procedure for planning as well, it gives you very little time to think over what your objectives are, how they align with how the doctor is planning your hair transplant. So come 1 day before, so the consultation is done at around 2 o'clock. Pictures are taken. We send you the pictures on your mobile. You go back to your hotel room, think over what has been discussed, so that the next day morning when you reach the clinic, you have another chance with the doctor to discuss about your hairline, about your objectives, so that if there are certain significant changes, they can be implemented. Arriving the same day of the procedure is not in your best interest. It's not in the best interest of the clinic as well. You also have to be explained about the procedure and it takes a lot of time. On the day of the procedure, in the morning, we are tuned to getting on with the procedure, not discussing the procedure for a great length of time. Because the clinics are oriented that way, everybody is on standby. The anesthetist is waiting for the procedure to happen. and the entire machine is waiting for the procedure to start. So to have a lengthy discussion arriving on the morning of the procedure is a big no-no. Arrive one day before at 2 o'clock for the procedure to happen smoothly. About the meal. The day before the procedure, you can have most anything to eat, no problem at all. But on the morning of the procedure, just take a glass of milk or a glass of juice at 6 o'clock. If you're a hypertensive, take your medications. If you're epileptic or any other medications that you're having, take it in the morning at 6 o'clock with the glass of milk, a glass of juice. If it's too early in the hotel to get these things ordered from room service, from dining, you come to the clinic at 7 o'clock and we will give you a glass of milk or a glass of juice and whatever medication you brought along, which you have to have in the morning. Medications like antihypertensives, anti-diabetic, whatever medication you're having. So also we would like to see your blood reports that have been done one day before, or blood reports which have been done at your place of stay before you come for the hair transplant. You've already got them done in advance in consultation with the clinic. So on the morning of the procedure, you arrive not with a t-shirt, but with a front open loose shirt. Okay, and do not have wear any tight-fitting garments. Wear slip-on shoes, not laced shoes, because once the procedure is over, we do not want you to be bending down to tie your laces. And that is all about preparation for the procedure. And the same night you return to your room, the driver leaves you to your room. You have to be very careful that you do not bang your head. You have to be very careful you do not talk too much. If your temple points have been restored, there is no chewing allowed. Do not take hard food. Take only soft diet, which you do not have to chew on. Do not bend forwards. If you want to see your WhatsApp messages, bring your phone up at eye level. Do not bend forwards. Do not use your laptop. And you have to recline backwards, 60 degrees backwards. Put 5 or 6 pillows against the back of the bed. Spread a towel and then roll up a towel which conforms to your neck contour. Cross the limbs across your chest so that you do not bend to the right or to the left or forwards. And this is the position that you have to maintain the whole night, on the first night after the procedure. Spray with the saline solution provided every 20 minutes till midnight, after which you can go to sleep. Take the medications after dinner, whatever dinner you have had. And the next day morning when you get up, you can have an ample breakfast. You have no restrictions about diet at all. And spray 1 or 2 times before coming to the clinic for a follow-up, where during the procedure, we will clean up the grafts, we will remove the bandages, we will explain to you the care for the next 2 weeks and for the next 6 months, and also give you a whole kit for you to carry home. So that was the talk for the day, how to prepare for a hair transplant when you're traveling from out of town. If you have any questions about preparing for a hair transplant, let me know. Leave a comment in the comment section below and I'll get back to you at the soonest. If you want your questions to feature in the next live stream session, do leave your question below or mail me on my email address provided in the link in the description below, or WhatsApp us on the numbers provided. Have a nice day, God bless you, and have a nice hair transplant which you have planned, which you spent so many months in planning, and for which you are very eager, and hope it is safe and you achieve whatever you have set out to achieve in your long hair restoration journey. Thank you.